So, first question, and I guess because I'd like to ask so many questions, it would be better for us to not go into great detail on each question, but just answer it. You can skip it if you don't wish to answer it. All four of you can answer it. Whoever wants can answer it. I guess for each one, I'll just let you decide. Do you want to go in a certain order, or you want to just speak freely?
I'm fine to speak freely, I think. I don't.
Okay.
Is this Jeopardy? Is there a button we can hit like Jeopardy? Or is this like, or is this Dancing with the Stars? We have like these boxes and they light up the box or something.
All right, so here we go. The first of 50 questions. Number one, Dr. Fuhrman, last night you mentioned something about our weight and its correlation with cancer. So if someone's eating a whole food plant-based diet and they're doing great, but they weigh 170 pounds, and their ideal weight should be 155 pounds, does that mean that even though they're eating a whole food plant-based diet, that they should be focusing on cutting the fat or eating less to get down to 155, meaning that both people are on a whole food plant-based diet, but are you saying the one that weighs 15 pounds less would have a lower risk of cancer? You could all answer this.
The quick answer is yes, that body fat, when a male's body fat starts to inch up above 15%, a woman's body fat goes above 25%, we start to see more insulin resistance, more pre-diabetes, more pro-inflammation coming, more interference with the immune function, and we start to see increased disease risks. And it's usually due to wrong food choices, it's usually not eating too much, because they can eat more, still eat a lot of food and eat foods that have a lighter caloric density, more vegetables, eggplant, asparagus, artichokes. They can still eat a lot of food, but it's usually making the wrong food choices that leads to that, not a person eating perfectly. Usually when they get their diet right and they get them eating a good assortment of natural plants, they don't have to restrict portions that low, and they could still keep their weight more favorable. So yeah, I do advocate nutrient density in the cells and reduction of toxic waste in the cells. And the body works best with a high phytonutrient exposure in each cell. And we do that by modulating our diet to be as favorable as possible, to as much favorable foods as possible to achieve those kind of results. So it's suspicious that this person probably could do a little better job if they're still 25 pounds overweight.
I think it was beautifully answered. The only thing I would add is that to focus on the true meaning of whole food plant-based. If the food that the person is consuming is truly in a state where you could recognize it growing in the garden, or cucumbers, beans, kale, it's mostly fiber and water is what those foods are botanically, chemically, and that is a great liberation, because if you go back for a third bowl of vegetable soup, who cares? It really doesn't matter. It's all fiber and water, and it sloshes through you, and you poop out the fiber. It's when you start adding not only the very nutrient dense foods. You don't want to eat 8 avocados a day, but also when I heard whole wheat go by, and so once you put flour products into the food stream there, that changes a lot. The sugars in the flour are absorbed more rapidly, greater insulin response. It's harder to burn off your own fat if there's a lot of sugar in your blood from the flour products. And also to hold that whole wheat bun together, the whole wheat bagel, whatever it is, there's usually there's a fat involved. The flour would just fall apart. There's some fat. There's a shortening in commercial baked goods. There's a shortening. It's egg yolks. It's but in the vegan world, nut butters, etc. Well, once you get that fat sugar combination going, and you take a bite of the vegan donut or whatever it might be, and the fat and sugar enter the blood at the same time, the body says, sugar, fat, I'll burn that sugar now. It's easier to burn. I'll store that fat for later. And that fat-sugar combination is really notorious for really piling on the weight there. And when you pour oil on your pasta, you're creating that fat sugar combination. The almond butter and jelly sandwiches, you'll burn the sugar in the jelly and the bread, you store the fat in the almond oil. So so I suspect if you really had that person bring in an honest food diary for 3 or 5 days, you'd probably see the foods that are keeping them heavy there. And you want to break up those fat sugar combos, eat them separately, but keep their belly full of whole vegetables and fruits, and the weight will come down.
And
Uh,
the
just-
only,
Go ahead.
yeah,
Go
go
ahead,
ahead,
Brenda.
Matt. No, you go ahead. Go ahead.
Okay, no, I was just gonna add, that's the thing with jumping in. I was just gonna add that to be clear, as Dr. Fuhrman had mentioned, it's specifically excess body fat accumulation, so not necessarily just weight. So for example, if somebody's a bit taller, then for them a healthy weight might be a little bit higher than somebody who's shorter and vice versa. So I just didn't want someone to come away thinking it was all just specifically about weight, because things like muscle mass and bone mass and everything play into that as well. And one thing that we could point to really hone in on the fact that obesity or excess adiposity specifically increases risk is bariatric surgery. So surgery that leads to weight reduction also lowers cancer risk. And that's usually, I wouldn't say necessarily always, but often associated with, not really a huge significant change in diet quality. So people just end up eating less, they lose fat, but they still have a lower risk of certain cancers.
And the other thing I'd like to add is I found it really interesting. You're, I know, all aware of Roy Taylor's work, and his latest study was called Retune. And one of the things that it brought out was the personal fat threshold. And so even people with a normal BMI may actually be overweight, even though we would consider them normal weight. So they may be storing excess fat in their liver, their pancreas, and even a small loss of 5 to 10% of their weight can lead to like a 40 to 80% reduction in the hepatic and pancreatic fat levels. And so for some individuals, especially if they, their BMI is normal, but they tend to hold a little extra weight in their abdomen area, sometimes they actually need to lose weight, even though they're normal weight. And we see this so often in Asian populations. They might have a BMI of 23 and be overweight. So this is just something to be aware of. It can make a huge difference. You can improve insulin sensitivity markedly by reducing these fat deposits in these organs.
Okay, if someone says, I saw your lectures, I read your books, and I'm totally in, I'm gonna eat a whole food plant-based diet all the time, just like 3 or 4 days a week, I have eggs in the morning. Is that, and obviously they do not want to increase their risk of a disease, but they would like to include eggs 4 days, 2 eggs 4 days a week. Is this a big deal, or is this not that big a deal? How should they think about eating a healthy, whole food, plant-based diet, but also adding in eggs in terms of disease prevention?
It's a bad idea. Why in the world to start your morning off with the 2 big gloms of the most concentrated collection of saturated fat and cholesterol on the planet? That's going to head for places that it shouldn't, like the visceral fat stores, your artery walls, and the fried albumin in the egg white, probably not friendly stuff either. Probably increases IGF production by your liver. It's a bizarre thing to start your morning off with. It's strictly a taste thing, a comfort food thing. Good heavens, there's better stuff to eat than 2 eggs. And we can talk about, some elevates the risk of this, and that from all the saturated fat. But basically, it's time to change the person's taste. It's either oatmeal and fruit in the morning, or even the just egg stuff. If you have to have an omelet, I'd rather it be pea protein than true egg products there. So I'm not a big fan of 2 eggs in the morning, to say the least. And I think they're increasing their risk for a number of medical problems.
I'd say that there are two really critical things to consider here. One is the dose, and two is what you're replacing it with. So for one, if you look at eggs versus meat, and there are studies that essentially do that comparison, you see that eggs are healthy. So if you're replacing things like bacon or sausages with eggs, that's a better choice. But if you compare eggs, especially daily consumption, with plant protein sources, the plant protein sources win out every time for things like cardiovascular risk, all-cause mortality. Now, would I, extend that to like one egg a week or something? Probably not. But if we're talking, two a day, 3 to 4 days a week, that's about one a day average. That is about where we see risks start to accrue, especially if it's consumed in place of plant protein. So I'd say the plant protein sources still win out pretty handily there.
And the studies that looked at replacing 3% of calories from animal protein with plant protein, the large studies, Singh from 2016, and then the 2020 NIH study, eggs were, one of the best things to replace with plant protein. The numbers were sort of in the 20% range for risk reduction, so mortality risk reduction. So I think and eggs don't have any fiber. They don't provide the phytochemicals and antioxidants that you would get if you were eating a whole food plant-based breakfast. And so we have to consider that as well. Like Matt said, what you're replacing, well, if you're replacing really good, healthy whole plant foods with eggs, it's not such a good trade-off.
Right, you guys just said this, the same thing. What you could eat flax seeds and chia seeds and some groats and some, like Brenda does, with black lentils and groats with there's so many anti-cancer longevity promoting foods you could have replaced those calorie with. It's all, right? We can do so good with, we know so many foods are so longevity promoting and cancer protecting that we can put in our breakfast. Let's pick those.
This morning we had a speaker named Anthony J, whose lecture, the topic of his lecture was, let me say, I think it was called something about estrogenics, about estrogen or chemicals and pesticides in our environment. And I heard him say something about chia and flax. I don't want to say this wrong, but something to the effect that the lignans in them had dramatically higher estrogen or something like that in chia and flax than any other seeds. Can you help me out? What was he saying? Is this a concern? Should I avoid chia and flax because it's more estrogenic than other seeds and nuts?
Yikes.
Well, flax seeds are the most concentrated source of lignans on the planet, and lignans are a phytoestrogen, and that's why they're so protective. So
they block estrogen from hitting the breast of the prostate. And flax seeds have 20 milligrams per tablespoon, and sesame seeds on whole have about 20 milligrams per tablespoon, and chia seeds about 7 milligrams per tablespoon. And we are striving to eat more lignans in our diet. That makes we add it to it actually blocks the estrogen receptors from being overly stimulated and makes a person, protects us against hormonally sensitive cancers.
They're highly anti-carcinogenic.
Mm-hmm.
There was a study on women who had breast cancer, and they followed them for 10 years, and they tracked their lignin consumption, and those in the highest quartile of lignin consumption had a 71% lower risk of death over that 10-year period from the increased, and they weren't eating that much lignans, by the way. We recommend much more, and they're obviously not waiting to get cancer to start using them. But so this is...
No, sorry, I didn't mean
to
cut you off there.
I said
I was going to say, like, some of the strongest data I think we have for individual food components and mortality risk is actually with lignans. So when we consume lignans, they get converted or broken down into something called enterolactones, and we can measure the levels of that in our blood. So this is better than survey data where you're surveying people on what they consume. You can actually measure the levels that they have, so roughly how much they're consuming. And higher levels of these enterolactones are associated with, I believe it was a 45% lower risk of mortality and 30% lower risk of cardiovascular disease, or vice versa, in a meta-analysis that was published just a few years ago. Like, that's incredibly strong data of the health benefits of consuming lignans. So I would say go for it. That is something we should be encouraging.
By the way, of interest is that the Canadian flax seeds have lower amounts of cadmium compared to the American, us states or other countries grown. So we sometimes look to buy them on the Canadian tundra up there, have the best flax seeds with lowest contamination.
Today, I'm sorry, go ahead.
Is the level of cadmium at such a point at this time, Joel, that you would really tell folks eating American-grown flax seeds to limit their intake during a week? Is it concerning to you?
Yeah, because you know why? There's cadmium all over the soils and plastic in the soils, and we try to do the best we can. And if I can get a flaxseed that's been why not? If I'm eating it tablespoons a day, why not get one that is claims I'm clean? So anything I know I can get a company that makes it clean without in a better soil, might as well lower my cadmium level in my diet. Right? I'm not be fanatical about it, but I think that if I know the company's tested them, I have lower levels, might as well buy theirs, you know?
Fair enough.
Okay. What do the studies on fruits and berries tell us? I know that we constantly hearing good things about fruits and berries, and then occasionally we hear things about fructose itself being a concern. So, I mean, I love berries, and so do most people. Is this all good, all anti-cancer preventing, or are you concerned about the sugar and the fructose in this? Or if someone has, let's say, cancer, would they want to stay away from fruit or berries because of the sugar?
I answered that yesterday, so let somebody else take it today.
Okay.
I mean, I don't think there's any good data to suggest that fruits are at least harmful for cardiometabolic issues, for cancer risk. We have literal randomized controlled trials where they'll dehydrate and stuff berries into capsules and compare them to a placebo, and you see cognitive benefits. Like it's just benefit after benefit after benefit. So this is something actually I think that a lot of people sort of miss when they hear some kind of fear-mongering headline or someone on social media mention some pathway or mechanism. Is we always have to sort of step back and be like, what actually happens to humans when they consume this food? Like, what is the end result? You know, exercise raises levels of inflammation temporarily. That doesn't make exercise bad, because at the end of the day, you live a longer life, have a lower risk of heart disease, lower risk of diabetes, etc. So we have to step back, look at what is the end result, and it's consistently positive for fruits, especially berries.
I completely agree. I don't have a lot to add. I think that these studies, the evidence is overwhelming that fruits provide a wonderful array of phytochemicals and antioxidants. The fructose there is managed quite well. A lot of it is converted in the intestinal tract before it's even absorbed. You know, when our liver gets overwhelmed with fructose, it's because we're consuming concentrated sources of fructose from mainly ultra-processed foods, not from fruits. So we generally have the capability of managing the amount of fructose in fruit, considering the fiber and such that slows its absorption as well. So I have no concerns whatsoever about a relatively generous consumption of fruit. I think it's all good. And like Matt said, I completely agree. Berries are sort of at the top of the, you know, the pile where fruits are concerned.
Absolutely agree. Couldn't add much to that. The fructose that's naturally in fruits comes in with water and fiber and vitamins and minerals, and the small amount of it does good things in our body. As Brenda said, it's when the fructose is from corn syrup is concentrated and then added to cola drinks and candy bars and all the processed stuff that piles up in our liver and gives us fatty liver. That's a problem. And you know, fructose has gotten smeared with the same broad brush that a lot of other the carbs have gotten. But no, eat, my child, enjoy the berries. It's good for you.
When we are told that fiber is good for us, is there a difference? Is vegetable and sprout fiber the best fiber, or is cooked beans just as good? Is whole grains just as good? Is fruit, is nuts? Like, is there any difference between the different types of raw or cooked plant fiber, or is it all the same?
There's great differences, and we need them all. They each do wonderful things down in our intestine to move the fecal mass along, but to, very importantly, feed the microbes that are living down in our colon, and the resistant starches from the beans feed one set of microbes, and the more fibrous fibers from the celery and the asparagus feed different types. And so it's the whole food mass. That's why you want to eat the rainbow for not only vitamins and minerals, but all the different kinds of fiber you're going to get from it. And so, again, eat from the garden, and your microbiome will be happy, and you won't have to take probiotics. They're all, the good guys are already down there. The bad guys are down there. Feed the good guys with the fiber, and there will be harmony in your colon.
And it's one of the reasons it's so important to have variety in your diet. That the variety of fibers, viscous, non-viscous, fermentable, non-fermentable, all of these different, there's so many different types of fibers, and they all play unique and very, very important roles in the gut, and our production of short-chain fatty acids will vary depending on the type of fiber. And so, people that eat typical North American diet and pour a little, have a Metamucil drink or sprinkle a little bran on top, they're not going to be in the same league as people eating a whole food plant-based diet that are eating multiple different types of foods that provide different types of fibers. So it's, this is an important point. We need variety.
Yeah, look at the people we have speaking here. What we're advocating is kind of unique. And we all corroborate that we're eating multiple types of green vegetables, multiple types of beans, multiple types of berries, multiple types of fruit, multiple types of mushrooms, multiple types of nuts. We're actually multiple types of intact grains, and we're eating. So we're actually within each category, we've been eating multiple types. So we have a huge diversity, which gives us this opportunity to have a better health and longer life and better microbiome and all the things that lead to a longer life.
And I have absolutely nothing to add. I think that's it. Eat the rainbow.
Okay. How do you address the common misconceptions that plant-based diets are inherently low in protein? And what are your go-to sources of protein in a whole food plant-based diet?
Well, inherently is the key there. Like that. So saying it's inherently lower in protein means that you can't match protein, and that's simply untrue. So I'll rattle off a few examples. If you replace eggs with tofu and eat the same amount of calories, you get more protein. If you replace most dairy milks, with the exception of skim, with a soy milk, you increase your protein intake. If you replace regular cuts of like 80% lean beef with tofu, again, about similar protein. If you swap that out for TVP, which is like soy protein with much of the fat removed, or with seitan, which is a wheat-based protein, you can actually increase your protein. So there are protein sources that could match or even exceed the animal-based options. It's just a matter of maybe a little bit of education. Not that everybody needs to obsess over it either, to be clear, but to say it's inherently lower in protein is just simply untrue.
And I think it's important to recognize that the average person eating a plant-based diet is getting about 12 to 15% of calories from protein. Total protein intakes tend to range from around 60 to 90 grams. The RDA is 46 for women, 56 for men. So, we do consume a little less than omnivores, but we generally exceed the recommended intakes. It doesn't mean that protein's never an issue, because sometimes it is, especially in older vegans who are eating small portions, the tea and toast kind of diets. They need more protein because they're not absorbing it as well. And so sometimes they do fall short. But that doesn't mean they can't get enough if they make a few little tweaks with their diet. They need, as we grow older, I know for myself that I'm focusing a little more on beans and lentils and tofu and tempeh and those kinds of foods, and a little less on grains and starchy vegetables to keep, where I need to be in terms of protein and caloric intake. And I make my own tempeh at home. It's an easy thing to do, but generally the legumes, tofu, tempeh, edamame, these are really wonderful sources. And of course, seeds are an underappreciated source of protein as well. like hemp seeds and pumpkin seeds especially. So those are just a few other thoughts.
Right, when you add, legumes and green vegetables and nuts and seeds in the meal, you shoot up the protein and the phytochemicals and the absorption. But keep in mind that out of the 5 categories of plant foods, fruits, vegetables, beans, nuts and seeds, and intact whole grains, fruit has the lowest protein. So we don't recommend people eat a fruitarian diet where they get the majority of calories from fruit, especially as we get older. That's when only the way people can have their protein be marginally low by overeating fruit, not that fruit isn't a good food. And the other thing is using oil on their food. Because if you look about it, if you put the average American consumes 500 calories of oil or a couple of tablespoons of oil, which is just the fat without any protein. If you took those same calories and replaced nuts and seeds to place the oil, you would then add 10 or 15 grams of protein into the diet. So the more oil you use on your food, the more you're using fat with no protein that accompanies it. So that's a way that people dilute the protein. So it's sugar and salt, it's sugar and oil that really cut the protein down, putting those empty calories that really cut the protein of your diet down.
Yeah, well said. Find an artistic way to get more legumes into your diet: bean burritos, bean chilies, lentil stews, hummus sandwiches. It's a vast, wonderful, flavorful, toothsome family of foods there. So at least once a day, have a good leguminous entree in one of your meals there. But find a way to sprinkle them. You can put chickpeas on your salad. Lots of ways to get protein into your diet. So yay for the legumes.
Okay, you could all answer this, but let's start with Dr. Klaper. Dr. Klaper, you mentioned the resistance you've encountered from some medical professionals. Based on your experience lecturing in medical schools, what are some of the common scientific or physiological arguments used against the idea of dietary disease reversal?
Oh my, that's such a large, important question. I lecture to the nation's medical students before pharmacosclerosis sets into their brains, and try and tell them, one, the majority of diseases they're going to be seeing are reversible diseases, the high blood pressure, clogged arteries, type 2 diabetes. And second, a whole food plant-based diet is the key to reversing those diseases. Excuse me, a little hoarse today. And this is an important message for the students to get, and you can't unring the bell. I'm glad that I put that into their heads. But there's always some professors in the back of the room with their arms folded and shaking their heads because this is a threatening message. It threatens their understanding of what disease is. We've been teaching med students that what our patients are eating has nothing to do with these diseases. It's all genetics and environmental stuff and stress. It's the food doctors, so it threatens their understanding of the causation of disease. It threatens their model of practice. The dietitian should be part of the primary care treatment team. The doctor doesn't have time to do nutritional counseling, but the dietitian or a food coach does. We need to change the structure of primary care so the initial patient is shunted to the plant-based coach or dietitian at that first visit, or may have a connection with them. And it threatens their financial model, of course. The medicine is based on people get paid for doing things to patients, putting in the stents, doing the bypasses. You don't get paid for telling the patient to eat rice and broccoli. And so all the way around, this is a threatening message to them. And but the truth is the truth. And there's people's arteries don't care about the financial model. People's blood pressures and insulin receptors don't care about the way the bean counters count the beans in the accounting department. So so I show them pictures. I show them of the studies of how a whole food plant-based diet can reverse type 2 diabetes as the low fat stream clogs the insulin receptors, and you see the A1Cs go down. And I show them, of course, the classic pictures of artery plaque melting away. And it's hard to argue. All of us who are practicing plant-based medicine or lifestyle medicine, we've all had patients with angina go away. We expect it to. And yet to the cardiologist, this is miraculous. It's an anathema. Nobody's angina goes away. Of course it does, doctor. And so I show them the pictures, show them the studies, and assure them that already there are practitioners in the field doing disease reversal. In fact, I showed them the International Journal of Disease Reversal. I tell them it's a thing, reversing these diseases. You need to know that. And I usually get out of town without too many arrows in the back. And again, the students have heard the message. And I said, don't cause a big ruckus in your medical school. But when you get out to practice medicine like you know it ought to be practiced. Take history and physical, or your labs, or get them on medications, but then link them up with that plant-based health professional and follow them back in a month, see if they're not healthier. This is how medicine should be practiced in the 21st century. So you present the evidence and let the chips fall where they may.
Anyone else want to comment on that, or I'll move on?
We've got a long way to go yet. Move on. We'll
Okay.
keep chipping away at the wall there.
Okay. Are there any types of plant-based foods that you've found to be particularly beneficial in managing or reversing insulin resistance in type 2 diabetes?
Absolutely. So
Sure.
there are a lot of foods that are really helpful in that regard. And I would start with, when we, I think about the work in the Marshall Islands, and we got a lot of little lessons from that work. And for those of you that aren't aware, the Marshall Islands research was published in Diabetologia in 2024. And we have among the best results, I think, that are out there. We had, I know, Joel, with your study, you had a reduction of 2.4 percentage points in A1C. We had a reduction of 2 percentage points. And we did an analysis that found it would have been 2.4 had we not reduced medication so much. But in terms of specific foods, I'll start with leafy greens. You just want to load up. They are such beneficial foods. Dark leafy greens should be at the, taking a big chunk of the plate. I would say every single day, a giant salad with a lot of leafy greens and non-starchy vegetables that cover every color of the rainbow. And then few berries on top, and then you want some sort of protein. And the best protein source for fighting diabetes is legumes. So, all of the legumes, the lentils and so forth, throw some of those on. And then where grains and starchy vegetables are concerned, we learned a lesson very quickly that those are foods that you want to control portion sizes of, especially for people that need to lose weight and who are very insulin resistant. And so we kept grains intact. So I created something called the whole grain hierarchy, where at the top of the hierarchy are intact whole grains. And these grains take your body some work to break down and to absorb. And so they impact, they have a very small impact on glycemic index, or the postprandial glycemia, compared to grains that have been ground or flaked or puffed. And so you want grains intact as much as possible, and then control portion sizes. And even within that, you want to stress more the lower GI grains. So for example, barley has a glycemic index under 30 compared to brown rice, which may have a glycemic index in the 80s or 90s, depending on the type of brown rice we're talking about. And so you want to be selective even within food categories. And then the other foods that I think are highly underrated and very, very valuable are nuts and seeds. And I would put seeds above nuts because they tend to be a little more nutrient dense. They have more essential fatty acids generally, and they're very high in fiber, high in protein, and just very, very valuable foods. And I think they're underappreciated in a lot of diabetes trials. And so I think they're also highly, highly valuable. They help to reduce postprandial glycemia as well. So those are all things that I think are very important to include. And then of course, some fruits as well are important.
You know, of course, we're all on the same page here, but I just want to repeat something to make it clear is that we're talking about body fat that interferes with insulin resistance, as well as the lipemic load of the meal, that the combination, pardon me, I have a dog on my lap.
Oh,
Anyway, she got in here. I don't know how she got in here, but anyway, the lipemic load of the meal, we're talking about when you use oil, those fats flow into the bloodstream with a load all at once. And the combination between the lipemic load with the body fat makes for insulin resistance. And when you're eating oils, those fats come in the bloodstream 30 to 50 calories a minute, versus nuts and seeds are a source of fat, 1 to 2 calories a minute. So we're getting our fat into the body gradually, so it doesn't put a huge spike of fat in the blood that makes the meal more glycemically unfavorable. And we see generally type 2 diabetes resolve and people don't need medications with normal blood sugars in 3 to 6 weeks. Even when they're still overweight, they're eating the right foods, they haven't lost all their excess weight, and their diabetes is already gone. So it's pretty easy to repair that. And to also mention that some of the medications used for diabetes, which push the failing beta cells in the pancreas to produce more insulin to lower blood glucose, lead to increased morbidity and even mortality in diabetics. So medication is not the answer to lower blood sugar. It's really the things we're talking about here, that it's lifestyle medicine that really prolongs lifespan and also enables people to reverse diabetes, not just treat it, but get rid of it.
Mm-hmm. And I just have to add one thing, because again, in our Marshall Islands trial, we found one of the most valuable ways of reducing postprandial glycemia was moving the body after every meal. And so every time people ate, we would be out walking. We did an hour of exercise every day, but on top of that, we did the post-meal walks, and we couldn't believe the difference it made in blood glucose levels.
I can add maybe, I don't think there's too much to add, especially to the foods specifically that Brenda had mentioned, but I like to think of foods when I'm working with a patient as far as like swaps. So I look at like, what can we swap out and what can we replace that with? So if somebody's eating white rice with every meal, we might swap that for, well, at least a brown rice, if not a quinoa or millet or sorghum, or there's a million different whole grains out there. If they're eating meats, especially red or processed meats, swapping those for legumes or tofu or tempeh, more fiber, lower calorie density, obviously less saturated fat. Those are all positive swaps when it comes to managing blood glucose. And you'd mentioned Brenda, Roy Taylor's work earlier. He's demonstrated some of the greatest results probably ever as far as putting type 2 diabetes into remission. And they were basically very low calorie, vegetable and meal replacement diets. And he would do them until they were at whatever weight threshold they were going for, and then kind of reintegrate foods after that. And with weight loss being a key here, I don't know if you remember the numbers, but it was a majority who actually achieved remission. It was well over 50%.
In the direct trial, it was 46%, and it was 86%.
Oh, so it was just around 50%.
Yeah, it was 86% for people who had lost at least 15 kilos
Right.
or 33 pounds. It was 57% for people at 10 to 15 kilos or 11 or 20, I guess 20 to 30 pounds or so. And then it was, I think, 30% for 5 to 10 kilos, and it was 7% for people that had lost 0 to 5 kilograms or 11 pounds. So just an absolute direct correlation with the amount of weight loss and the chances of remission. So people that lost over 15 kilos, 33 pounds, 86% of them went into remission, which is pretty remarkable.
Mm-hmm.
You've all just heard a great scientific discussion about the effects of plant-based diets on diabetes. I'm just saying we've got a big educational job to do as far as the public's understanding, because when someone hears, oh, we got diabetes, oh, sugar, too much sugar, don't eat sugar, and that opens the door to low carb diets and all the silliness that comes from that, then eat more fat. And the problem is not the sugar, it is the fat is the problem, clogging up the insulin receptors. And the fat that comes from the visceral fat stores as well. And so primary care docs who are, before you reach for that metformin prescription, talk, what is your patient eating? It's the fats and the diet, it's the oils and the meats and the dairy and that's the problem. And if we can get, that should be on highway billboards, it should be on PSA, should be on TV commercials to educate the public about healthy eating and let them know, all the folks with the high blood sugars, it's the fat that you're eating. Type 2 diabetes, even type 1 diabetes, high fat diets still clog up whatever insulin receptors you have. So it's the fats, folks. The sugar is the tail of the dog. But don't eat refined sugars either. They're not healthy for you. They get your sugars out of the fruits and vegetables.
I think it's important to remember that sugar is converted to saturated fat if we eat too much of it. That's an important point. Second is that a lot of people think they need to do a very low fat diet to reverse type 2 diabetes, so 10% of calories from fat. But in fact, our study from the Marshall Islands, Dr. Fuhrman's study, and Counterbalance and Counterpoint and Direct, all used diets that were slightly, Dr. Jenkins' studies have all used diets that were somewhat higher in fat. Ours was 20 to 25%. Counterpoint and Counterbalance and Direct, I think, were 19.5%, but they weren't 10% fat. And so what's more important than the percentage of calories from fat is not over-consuming calories. If you reduce calories enough to get weight loss, that's a really critical thing. So you can include some nuts and seeds, as we did, as Dr. Fuhrman did. Counterbalance and Counterpoint were more liquid calories, but it was still around 20% of calories from fat. And we had greater results than the very low fat trials, like PCRM's trials that produced a 1.38 percentage point drop in A1C. Ours was 2, Joel's was 2.4. And so I think just so you don't have to think that you have to do a 10% fat diet and you can't eat any nuts or seeds or avocados. You can, just so long as you keep calories low enough to produce weight loss and get rid of that ectopic fat in the liver and pancreas and muscle tissue.
It's been said that there's a role in diet in regulating hormones like estrogen and insulin. How does this relate to the prevention of hormonally sensitive cancers such as breast and prostate cancer?
It's what we've somewhat been talking about so far, even in this interview with all of us today, because one thing is that when you regulate body fat, you regulate your production of these hormones like insulin and estrogen, because excess body fat doesn't just make for insulin resistance, it also drives aromatase to produce more estrogen. So one thing that's the biggest, so what we eat, which then affects the body fat, and because body fat is poorly perfused tissue, it spews out more pro-inflammatory substances, cytokines, lipokines, that activate the aromatase production of estrogen. So we do modulate estrogen, and we also modulate insulin and estrogen simultaneously. At the same time, keeping animal protein low, we're keeping insulin-like growth factor 1 low as well to have the triad of low hormones. And as Brenda just said, excess calories also drives up insulin and IGF-1, just overeating. So we have overeating, we have body fat, and we also have phytochemical exposure and exercise. So all these things combined affects our hormones, mTOR, SIRT1, AMP kinase, all of these longevity proteins that stabilize our stem cells. All these things get in a favorable range, and it's really what happens when you eat an American style diet, that you discombobulate all these protective mechanisms, and then you have hormonally sensitive cancers that get promoted. And we mentioned earlier, the lignins in our diet. We have high lignin diets, as Matt pointed out, how they're processed by bacteria in the gut to have protective compounds that also protect us, our tissues, against excessive hormonal stimulation. And also mushrooms have tremendous anti-aromatase and anti-angiogenic effects too. So the food and soy products have isoflavones that are so interesting because they block estrogen stimulation of breast and prostate tissue, yet they stimulate the E2 receptors on bones and muscles to help us keep our bones and muscles strong as we age. So it has so the diet that we're all recommending with all these individual features collectively adds this degree of hormonal protection.
I think another source of hormonal imbalance comes in the dairy products that people are consuming these days. My uncle's dairy farm in the 1950s, when a cow was fertile, we'd lock her up in a stanchion, and the breeder guy would come in and ram a tube of bull semen into her uterus, and she would conceive. And if she had been giving milk, she dried up, she stopped lactating. Pregnant mammals stop lactating in general. Well, we only had 49 cows. My uncle would pull out the notebook, bossy number 16, won't give milk till she has her calf in the spring, and that's just biology. Well, in today's modern dairy operations are milking 1,000 cows or more twice a day. They can't afford to have their best milkers go offline for 9 months while they're carrying their next calf. So they've genetically modified the American dairy herd and most of around the world. And so now the cows will give milk, even though they're pregnant with their next calf. They're carrying their next baby. They're still sucking milk off these large pregnant bovines. And as any woman who's been pregnant will tell you, when you're pregnant, your whole body is filled with estrogens, make your breasts big and your hair grow. But it gets into the milk, gets into your breast glands, gets into the milk. And so these are not the puny little phytoestrogens in soy. These are official mammalian estrogens. This is estrone, estradiol, estriol, pregnanediol, progesterone. And it's been shown when people are given glasses of whole milk, testosterone levels fall because of all the estrogens. Estrogen levels rise. And the epidemiologic studies show that not only do women who consume lots of dairy products get more breast lumps, if they have a breast cancer or a uterine cancer, it's like throwing gasoline on a fire. It can really accelerate the growth. And estrogens make the prostate gland unstable. And the men who eat the most dairy get the most prostate cancers. The more cheese and dairy a boy eats, the higher his risk of prostate cancer when he becomes a man. So all the way around, our diet is riven with estrogens, both from what we're generating ourselves in obese bodies, as well as coming in the food. So a whole food plant-based diet makes both of these problems melt away. And so, and there's so many good things now to pour in your cereal, so many good plant milks. There's vegan cheeses and ice creams and yogurts. They're treats. They're not healthy foods there, but no one really needs to be eating the products that come out of the udder of a cow. It's filled with things you don't need, including all the estrogens.
On the note of prostate cancer, there was a publication from the Adventist Health Study 2, which I'm sure everyone on this call is familiar with, where they looked at Seventh-day Adventists across North America, and they actually looked at both dairy and soy consumption and prostate cancer. And they found that specific swap of swapping out, say, your dairy milk for soy milk was associated with a reduction in prostate cancer risk. Off the top of my head, I can't remember the exact percentage or magnitude of reduction, but it was a consistent finding there. And then we also see with soy milk, as Dr. Fuhrman had mentioned, because of the way that the phytoestrogens interact with estrogen receptors in the breast tissue, they actually tend to reduce risk of breast cancer. And this is something that's actually appreciated by the Canadian Cancer Society, by the American Cancer Society, even noting that in people with a history of breast cancer, soy consumption tends to be protective in the long term as far as risk of mortality or recurrence of breast cancer. So pretty much across the board, we're seeing that soy consumption is quite beneficial in these cases.
Okay, let me ask you to comment on 6 things. One, Ozempic and semaglutides, which I asked you last night, but for anyone that didn't comment, or you could comment again since it's such a big topic. 2, alcohol. A lot of people like to have some alcohol. Is this a little factor, big factor? 3, coffee. Where do you stand with that? 4, soy products, which we've talked a little bit about, but just to clarify. 5, fish. And 6, grass-fed beef. There's a person named Callie Means who's doing a lot of great work talking about the food industry. He's really seems fantastic, but he's very pro grass-fed beef. So, so semaglutides, which is Ozempic, alcohol, coffee, soy products, fish, and grass-fed beef. If you could each just give us thoughts of guide us on those 6 things. Yeah.
Semaglutide is the devil's drug, and I don't think anybody should be started on it. It does not cure obesity. You start out very obese, you wind up less obese. The principle, get your patients on a whole food plant-based diet at $1,000 a month and side effects. And most people stop the drug after 6 to 12 months. It's a triumph of advertising, but it's not good medicine. Ethyl alcohol is a poison to every organ in the body. It kills every tissue it touches. I really don't think it has any business in the human body. There's non-alcoholic wines, non-alcoholic beers. I really think getting the alcohol out should be a major goal for everyone. Coffee, there's studies showing that a cup or 2 in the morning doesn't do you any harm, and I think you can get antioxidants from other substances. It hurts my stomach, but a cup of coffee, I guess, in the morning is to get you started. Maybe 1 in the afternoon. I don't think it does any great harm. Fish has become filled with mercury and dioxins and lead, and now microplastics. As the generating fish nets break up out in the ocean, the little fish eat the microparticles you have to see under the microscope, but then the big fish eat those fish, and the big fish eat those fish. And by the time you get up to salmon and tuna, they have eaten all the concentrated microplastics. So one, you sure don't want to be eating those fish. And second, guess what happens to half the fish catch? It's ground up and added to cattle feed and pig feed and chicken feed. And so even the meat eaters who, I don't eat fish, you're still getting the microplastics from the fish. So all the way around, it's time to let the fish off the hook. It's time to let the oceans heal already. Yes, we've used fishing up. Turn that page, folks. It's become toxic to us and our future on the earth. And grass-fed beef is another gimmick. They may have less fat, but you could never possibly feed America's voracious beef appetite with grass-fed beef. There's so few of them; it would take up all the land in America. And they live long environmentally. The grass-fed cattle live 4 years, where the feedlot cattle are slaughtered at 16 months. So they have an extra 3 years to belch out methane and add to global warming. It's a real scam. I don't care what their cholesterol level is. And it's time to stop with the cattle out west. It's decimating the environment. And by the way, Stephen, Casey Means is a woman. She was an ENT resident at Stanford. And great speaker, charming, but she really thinks as long as it's organic beef, as long as it's unprocessed food, it's great for you. And she needs some education.
She has a brother, I guess, Callie.
Yeah, they're siblings. They're siblings. Yeah.
The brother's Kelly. She's Casey, right?
We have a tremendous amount of studies on the impact of beef on shortening lifespan from both cardiovascular death and all-cause mortality. And those studies are predominantly done on grass-fed beef, not on commercial feedlot beef. So whichever study we look at, whether they're done in Australia or South America, we don't see different results when people move to a more wild type of animal, of meat. We see the same detrimental effects. And that's why the World Health Organization, it's not just one study, we have 100 studies that corroborate this information. So you have to just have your head buried in the sand if you're going to think that that's the case. But if people want to eat a lot of meat, they're going to have to take those severe risks that come along with that. So unfortunately, it's unfortunate that some people with degrees and with credentials are either not familiar with the scientific literature, or don't review all of it, or have a bias that leads them to only promote a viewpoint that's not adequately supported by the preponderance of evidence we have. It's just not supported.
I wasn't sure if you were going to hop in, Brenda, but I guess I can try to run down these 6 real quick. Alcohol, I don't have much else to add. I mean, I would say our new Canadian guidelines are excellent. The ones that came out just, I think it was last year, the year before. Basically, 0 is the safest level, 1 to 2 a week, some risk, but not a ton. And from there, it just goes up. That's about as simple as I can make it for cancers, for cognitive disorders, for eventually, once you get up into regular intake, cardiovascular risks, and so on. Coffee, like Dr. Klaper said, I think it's fine. The research on it actually very consistently positive, if anything, but there are some individuals who are more sensitive to the caffeine, maybe struggle with anxiety when they consume it, get jittery. Certainly can affect people's sleep if consumed in the afternoon or beyond. But other than that, it's fine. Soy, we already talked about. Fish, I mean, as far as health outcomes, yes, it's consistently associated with positive outcomes, but compared to plant protein sources, there doesn't seem to be any kind of advantage as far as outcomes go, like heart disease risk, again, cancers, and so on. And when it comes to the ethical implications, I mean, we kill 1 trillion plus sea creatures per year. It's absurd, and of course, the environmental impacts that come along with that, I think, are more than enough reason to choose other options. Grass-fed, so I mean, yes, there's a slight difference in fat profile, and you'll see people skew these numbers to be like or it's not even skewing, it's presenting them in a way that makes it sound favorable. They'll say 30% more omega-3 fat or something like that. Well, 30% more of nothing is still nothing. That's how you have to think about it, is the total amount is super low. And we have studies that match fat content. So they essentially compare plant protein sources and red meat, but equating fat content. And we still see that the plant protein sources are favorable for outcomes. Again, mortality, cardiovascular risk. And we can look at the swap meat trial, which people in the sort of animal-based space hate. But this compared Beyond Meat products to grass-fed and organic meat. And the Beyond Meat products came out better for both a little bit of weight loss and LDL cholesterol levels. So that's using what many would consider, like Callie and Casey means, the best of the best. And still, even the Beyond Meat, the old iteration, the less healthy version of Beyond Meat, came out on top. Now, the one part where I think I would disagree with Dr. Klaper a bit is actually on the semaglutide. And that's because, for once, I don't know, first time in how many decades we're seeing a decline in obesity in the US. As far as rates of attrition, from what I can see, it's about 20% in a year. So, I mean, maybe we've seen different stats there, but that's fine. But I view it like, when it comes to obesity, we live in an obesogenic environment. Best case scenario, we would change the environment, have healthy, nutritious foods available on every corner, and make the McDonald's and whatnot less available. Unfortunately, that's not the world we live in, and different people have different urges, different chemical signaling in their brain that drive them to consuming these foods. And I liken it to a race. Let's say you have 2 people who are going to run a 100-meter dash, but one of them randomly gets selected to wear a 20-pound backpack. Now, I would look at that and say that that's unfair, right? That person has to wear an extra 20 pounds on them. because they didn't choose that. It just happened to fall on them like genetics fall onto an individual. What the GLP-1s do is, in my view, they level the playing field. So somebody who really struggles because of the wiring of their brain to say no to the McDonald's as they walk by, whereas I personally can walk right by and not think about it, it's allowing them to then walk by and not think about it, hence running that race on an equal playing field without the extra weight that was randomly put on them. So that's how I view it. Is there ongoing research? Yes. Are we seeing some positives there? I would say lower risk of cardiovascular diseases, reductions in type 2 diabetes risk, reductions in potentially obesity-related cancers. So yeah, that's the one thing that I think I would disagree on a bit. But that should never, in my opinion, be given without also dietary counseling. That is the other aspect of that needs to, like the lifestyle intervention also needs to be put into place so that they can do both versus just one or the other.
Anyone else on that?
I don't really agree with you, Matt, but I think that drugs for high blood pressure, statins, and these weight loss drugs fuel complacency. They lead to this feeling of yo-yo dieting, looking for magic. People are less likely to pay attention to really learning the tenets of lifestyle medicine. And I feel it puts the focus on the wrong syllable. And I think the majority of people that are going to be on these drugs are going to quit them. The weight's going to come back. The weight loss is not very significant. And we don't know the long-term dangers because that we'll know 10, 20 years from now. So we're dealing with quite an unknown here that could be more risky than you think. But my main problem with them is I don't see that having gastric bypass, lap bands, and drugs lead, when you follow people 3 to 5 years, leads to people resolution of their metabolic challenges compared to the type of education that we want to really give people, which doctors are not skilled in doing. The motivational techniques, the teaching about emotional health, and using all the tenets of lifestyle medicine to show how that, and I think that would beat out, if we did have the proper trials, it would beat out drug trials hands down in the long term. So I'm not that as much on board with those as you are, maybe.
Yeah, and I guess I can run through our things as well. I completely agree with everyone on the alcohol thing. There is no safe level of alcohol intake, so we need to absolutely minimize intake. Coffee, I think the evidence is fairly positive, especially for certain disorders like Parkinson's and so forth. So I've never had a cup of coffee in my life. And I don't think we need it, but I think that if one of the probably the worst things about coffee is what people put in it. So if you're adding sugar and cream or non-dairy creamers or whatever, that's what makes coffee so harmful. Fish, again, I agree with everything that was said. I think replacing red meat with fish is a step in the right direction from a health perspective, but possibly from an environmental perspective, there are big issues there as well. Soy, I think we all agree that we have a truckload of evidence for the benefits of soy. I would say sticking to organic is probably a good idea, but more first generation soy foods like edamame and tofu and tempeh and so forth is a good plan as opposed to the very highly processed variations. Grass-fed beef has a much larger carbon footprint than non-grass-fed beef. If we want to think about the environmental impact from a health perspective, again, not that much difference, even though it's a little better fat profile. The GLP-1 agonists, I'm not a physician, but I think wherever we can, we want to support people in making healthy lifestyle changes and eating more healthfully. There are some people that it may help temporarily, but in the long term, drugs have side effects and can have adverse consequences. So there's always got to be a pretty big risk-benefit analysis there.
Let me add one thing, and that is that even the small fish like sardines, we're dumping thousands of tons of garbage into the ocean. It's not just the plastics from fishing nets. And these microplastics and nanoplastic particles, when you eat a small fish, you eat the whole digestive tract, which is full with plastic. So you get tons of plastic even with the small fish, non-predatory fish. Furthermore, that we're seeing that a link between people who eat fish from inland lakes and higher clusters of ALS due to agricultural runoff and growth of algae and cyanobacteria, which filters down the toxin BMAA into lake fish, and also the coastal waterways off the continental shelf. We're seeing that there's clusters of ALS and PDS, Parkinson's dementia syndrome, around Chesapeake Bay where people eat more seafood, particularly bivalves and shellfish. The bivalves refer to clams, oysters, mussels, and scallops because they're bottom feeders and they filter a lot of water through them, and the plastic particles floating in the water filter and get stuck in these. And also the shellfish, like the crabs and lobsters that live on the bottom, could have 50 times as much of BMAA and plastic particles that filter down into these contaminated fish. So we're seeing now in the scientific literature clusters of cases of neurologic and mental disorders and effects of people eating fish from these polluted waterways. And we're just nonstop polluting our waterways. And also there's a relationship between the agricultural runoff from meat production to the nitrogen contamination of inland lakes, to the overgrowth of algae, to contamination of lake fish, is all a cycle of interrelated between animal husbandry and animal farming and fish farming, which contaminates waters and makes these things more toxic.
Okay, final question. Each of you just 1 minute answer or less. Assume that a child or grandchild came up to you who's never had any interest in discussing nutrition or health. They never were willing to listen. And one day they come up to you and they go, all right, I got 40 seconds. I got 1 minute total. Just tell me what you are certain of, not what you think. Tell me the things that regarding cancer, dementia, heart disease prevention that you are certain of. If I want to prevent disease, just tell me the things from all your research that are definite, not the things that are probable, but what could I ignore all the other things that I see in all the other books? What can you tell me that you are absolutely certain about regarding disease prevention, but not the long version, just the direct bottom line? If each of you could give us what you're completely certain of in under a minute each.
I can start. Number one, don't overeat calories. It's so important to maintain a healthy body weight. Number two, we want to include as much as possible the protective foods. So foods that provide fiber and phytochemicals and antioxidants and prebiotics and probiotics and plant stanols and sterols. And these kinds of components are consistently protective to health. So we're talking about, vegetables, fruits, legumes, nuts, seeds. We want to minimize the foods that are and the components in foods that are associated with an increased disease risk. And those are things like saturated fat, trans fatty acids, products of high temperature cooking like heterocyclic amines and new 5GC and endotoxins and all of these kinds of components, which are concentrated in two categories of foods: ultra processed foods and animal products. So you want your diet to focus on whole plant foods. You want to minimize all very processed foods and animal products, and you want to make sure you don't overeat.
Right, and you tell this 4 or 6-year-old that they understand what a natural food is, that whole natural plant foods save lives, protect against all causes of death, and we want that child to watch their parents and make sure their parents eat healthfully. Keep an eye on the parents and make sure your parents, you love them, you want your parents to be around, and keep an eye on your parents and make sure they eat a diet that's overwhelmingly predominating in whole, natural, if possible, organic plant foods.
You just heard two elegant viewings of what to tell this child from a scientific point of view and from the common sense view as well. And I would just tell that child, show them some pictures of gorillas and how they build these magnificent bodies on plant-based foods only. And that we're plant-eating hominids, and to honor our plant-eating nature and to learn about all the wonderful flavors and textures and colors that await you. And don't worry about the science so much. Eat the food that we were meant to, take a walk every day, laugh a lot, hug your parents, and enjoy your life in this wonderful world, and keep your belly full of things that grow out of the garden, and you'll live a long, healthy life.
Yeah, I was thinking when it comes to having a high degree of certainty, like what are the things scientifically that we could, really say we have that? And my mind went to LDL cholesterol, and then I thought we're supposed to be talking to a child here, so they won't care about that. So at the end of the day, I would say nutritionally, it's fiber. Like, the amount of evidence we have for fiber is so strong, and so I would just tell them to always look at ways to increase their fiber intake. So again, whole grains, fruits, veggies, a lot of the things that Brenda had talked about. But when it comes to nutrition, I don't know that there's any component that we have more evidence for than fiber.
Thank you all so much. It is really an honor to have all of you at once share all your knowledge with us. We really love you guys and really appreciate it. Can we unmute everyone so everyone else can also thank these leaders for sharing their information with us?
The American working person. This is what they came up with. Jeez, come on, have some gumption. Now, how long will this last? Well, not forever. The goal here